Welcome to INN CEO Talks. My guest today is Chris Bunka, who is the chair and CEO of Lexaria Bioscience Corporation, which trades on the NASDAQ under the symbol LEXX and on the CSE under the symbol LXX. Lexaria is a biotech company focused on its proprietary drug delivery technology called dehydratech. Now, the company has been granted 19 patents in a number of different countries internationally and submitted over 60 additional patent applications. Operating on an out-licensing and a royalty business model, the company generates most of its revenue from very high profit margin royalties, which are realized by licensing its patented dehydratech technology to other companies. Dehydratech is a breakthrough, disruptive, and highly scalable drug technology. It acts as a complement to drug delivery. It improves the way active pharmaceutical ingredients enter the bloodstream, and it increases the effectiveness of fat-soluble active molecules, all of which lower dosage. The company recently reported outstanding results in the delivery of CBD and antiviral drugs. And as my guest today, Chris Bunka, said, the results are awesome. Chris, thank you for joining me. Let's start by discussing where the company is at the moment in the development of relationships with Fortune 500 industry partners and getting them to embrace and use your technology.
Well, thank you for having me on the show today. The company, Lexaria, has made remarkable progress in the last 18 months or so. For a company that's as young as we are and as small as we are, we really do think it is quite noteworthy that Fortune 500 is paying attention to us. Now, it's never easy when you're the mouse beside an elephant, and they are large companies, at times with global interests. But as one example, our technology, you've quite rightly said, works with fat-soluble molecules. One of those molecules is the nicotine molecule. And we have evidence now, beyond any reasonable doubt, that our technology can greatly enhance the delivery of oral nicotine, doing away with the need for smoking or even for vaping. And a lot of people are still unaware that nicotine in a purified form is not cancer-causing. So there are ways here to improve the health outcomes for existing nicotine users. Well, as a result of all that and the studies that we've conducted over the last 2-3 years, companies like Altria, the largest tobacco company in America, and British American Tobacco, even larger than Altria internationally. I think BAT has operations in over 80 countries around the world. Both of those companies have formal relationships with Lexaria. We are not generating any revenue with either of them at this time, but we do have formal relationships with both. They've been putting our technology through its paces, and we do hope to develop those relationships as time goes by into revenue-generating relationships. And as you quite rightly introduced us, the way we foresee that happening is through royalty generation, licensing revenue, if they were to adopt our technology in their supply chain.
So your technology, in essence, then gives them the opportunity to literally create new products for their brand that deliver nicotine in a much healthier format. Because ultimately, I mean, that's what a smoker is wanting to do, is to deliver that nicotine to their brain, where it acts as quite a remarkable stimulant. I mean, this is the odd thing about smoking. You smoke, it goes into your lungs, and there's a very quick delivery system to your brain, and so you get that satisfaction. But to be able to take the smoking component out of it, but still have the speedy delivery, that gives a tobacco company, an opportunity to develop its products beyond its current model, which I'm sure it's something that they've been looking for quite some time.
Oh, absolutely. Gosh, what you've just said hits on so many really strong points. For example, everybody knows about Juul. Juul, of course, the vape company that skyrocketed from nowhere. Well, we were in discussions with Juul before they were bought by Altria, because Juul even was interested in our rapid delivery for oral. And I remember meeting with the former CEO of the company who told me quite frankly that they felt they needed a repertoire. They needed a number of tools in the toolbox, including they were looking at dihydrotech. But, with smoking, you're right. The delivery is very, very fast. We've evidenced in animal testing, now I'm talking about oral, so put it in a pill and swallow it. Delivery from oral to bloodstream, believe it or not, in as little as 2 minutes. So we're fast. We're outrageously fast for an oral technology. In addition, one of the reasons that the nicotine industry has really struggled with replacement products. So how do you replace a cigarette? Well, we all know about Nicorette, the gum, we know about the patch and other things. And one of the problems, and we've learned this through our international Fortune 500 discussions, is that smokers actually have 3 addictions. They have a chemical addiction to nicotine. They have a behavioral addiction. And this is the act of bringing something to your mouth, which is very primal in a human being and kind of programmed into us about gathering food. And then there's a third addiction, which is social, because smoking is primarily a social activity. People like to have a cigarette with other people. And so these other products that address only the molecular addiction fail to address the other 2, and that is why they've never really taken hold. With Lexaria technology, believe it or not, we have the ability today. If we had the regulatory approval to do it, we have the technical ability today to put a small dose, 2 milligrams, 4 milligrams of nicotine into your coffee cup. We could put it into your coffee, you wouldn't taste it, but you would feel it quickly. You could sit at your desk. Fortune 500 would never have to pay for another smoke break. You can enjoy your cup of coffee with your coworkers, with your friends. We could put it into literally any beverage and almost any food, as well as capsules and pouches and other things. So the technology exists right now. We need the regulatory environment and big tobacco to catch up to where we are.
Now, this technology can also be applied to pharmaceutical drugs as well, which if in the introduction I was talking about the fact that you're speeding up delivery, and in doing so, fast and slow metabolizers are going to, no matter what, are going to be receiving the benefit of the drug quicker. And as a result, they won't have to have as much in their system. Where are you at in being able to start to work along those kinds of relationships that are going to allow you to deliver the technology into that massive pharmaceutical market?
The pharmaceutical market is the one we're the most excited about. Chronologically, as a company, our development of the technology ironically started in the cannabinoid industry. That's where it was born. And we've got our oldest data and the bulk of our data in that industry. Then, starting around 2017-18, we started looking at nicotine, and only a year and a half ago, we started looking at antivirals. We actually predated the COVID by about 4 or 6 months. But at any rate, the pharmaceutical is our most recent foray. We've conducted a number of studies already this year. We're delighted that as of December of last year and as of a couple of weeks ago, we've now reported on, I believe, 4 or 5 different antiviral drugs, in which case we've been able to improve the delivery rates by 30%, 42%, roughly 100%, and roughly 200% in the case of one of these drugs. So we're just starting to get traction in the antiviral drug market. And when we talk about antiviral drugs, I want to make something really clear. Lexaria is not a pharmaceutical company. We're a technology company. So our technology can be adopted by pharma, by tobacco, by the cannabinoid industry to further enhance the products they already have. And in the case of the antiviral market, it's important to note that the drugs we're working with are all already approved for one antiviral purpose or another. Some of them, for example, for HIV/AIDS. Some of them are being investigated, like remdesivir has emergency authorization status from the FDA for treatment of COVID. But these are drugs that are being repurposed and looked at for additional use. And where Dihydratech really is a game changer, in your intro, you use the word disruptive. And I know it's a sexy word these days, but I want to caution people. Disruptive is hard. Yeah, it is exciting. Yeah, it means that you're really changing the status quo. But you know what else it means? It means that there are entrenched people out there, groups that do not want to see that come to light because we can negatively impact their revenue streams. So in our case, we are looking at repurposing some of these drugs, being able to take an antiviral drug that traditionally could only be administered, for example, by injection. And all of a sudden, we might be able to apply it in an oral form through a pill. And think about what that means just on the logistics, never mind the ease of use. Nobody likes getting a needle. But even on the idea that you no longer need cold storage, you no longer need deep freezers, you no longer need needles and syringes and healthcare professionals to administer it. The costs of administration of an oral antiviral drug compared to an injectable could be billions of dollars less. So for governments or health insurance companies, they stand to save billions of dollars just in administration costs if we can be successful in delivering an antiviral drug that was originally designed for an injectable form instead in a new oral form.
Wow. In going over your website, the areas in which you are moving into, they're complex, they're in detail. I would encourage anybody who has an interest in your company to visit your website. It's comprehensive look at where you're at, where you're going. But one of the things that investors might at the moment be asking is, what happened on May the 6th? How come you traded so many shares on NASDAQ?
Gosh, I wish I had a better answer. People who know me, we've had shareholders in our company. Some of our shareholders, believe it or not, have been with us 10 and 12 years. So we've really built up relationships with a lot of these people. And I try to speak to as many of them as I can. They've gotten to know me and they know I try to be as transparent as I can. Here's the facts. We have 5.1 million shares issued and outstanding. I own just under 10%. Another new shareholder in the last few months, an individual in New York, owns another 9.5%. We have certain long-standing, larger shareholders who together own another 20% of the company. So the 5.1 million shares, really, there's a float of maybe 3 million or so that's out there. We also have 2.1 million warrants that trade separately on the NASDAQ. We have no convertible debt. We have no death spiral financing. We've never done anything as silly as that in the history of the company. And we have a very low option and warrant count. So we have a very small share structure. I can also tell you that we are analyzing our shareholder lists more closely these days than we ever had in the past, because over the last year or two, we've seen unusual trading activity that has certainly been of interest, if not of concern. And what I can tell everybody, because it's factual, is this. We analyzed a shareholder list from before May 6th with the shareholder list generated shortly after May 6th. And we know for a fact that fewer than 800,000 shares of our 5.1 million actually changed hands. That's a fact. Less than 800,000 shares. Yet, on May 6th, we traded, it was printed as 48 million shares. We all know the NASDAQ double counts, so that's 24 million actual shares. But that 24 million shares was only fed a supply of 800,000. I personally do not understand how that's possible. I know that a number of our shareholders have filed a complaint with the SEC. So too has the company. I personally filed it myself. We've not heard anything back. But the only thing that logically, or at least from an arithmetic point of view, The only thing that makes any sense from an arithmetic point of view is that there was additional supply in order to feed that kind of volume. And the only other place there can be additional supply is from short selling. Now, short selling can be legal and short selling can be illegal. I think, I'm not an expert, but I think that for it to be legal, it needs to be covered and it needs to be declared. Well, if you look at our declared short, it's only 500,000 or 600,000 shares. That's certainly not a high enough quantity. So again, the logic leads me to believe that there is a large, undeclared, naked, uncovered short on our stock. How large? I don't know. The numbers defy logic, to be very honest with you, because in order to feed that 24 million shares of volume that day, we're ignoring tens of millions of shares of volume outside of that day, but just that day, you would think that there'd have to be, I don't know, 6 or 10 or 12 million shares of shorting going on, which should not be possible. So I can't explain it better than that. Those are the facts that I know. I'm certainly frustrated by it because it's my personal opinion that there is undeclared shorting going on in our stock, and that makes me angry as heck because that money rightfully belongs to our shareholders. And I fight hard for my shareholders. I will do it until I die. That money belongs in my shareholders' pockets, not somebody else's, and that's where I want to see it reside. So we're going to keep pushing. We're going to keep pushing the regulators, and we're going to see if we can get some answers.
Well, the follow-up question then for investors is, okay, is now the right time for me to be, joining you on this journey that you're on?
Yeah, this is where it gets funny, right? Because we all know CEOs. CEOs don't have any blood. They only have ice water in their veins. They have no emotions. They're all liars and cheats and scandals and all the rest of it. We all know that. Only I'm not. I'm a family guy and trying to do the best we can. I think Lexaria stock is outrageously undervalued. When I look at, the points of life in companies that have, traveled here before us, companies like GW Pharma. When GW Pharma was at our stage of development, they had a valuation $300, $500 million. Our valuation is 35. Of course, when those companies continue to go further, GW got bought out a couple of months ago for $7.2 billion. Our valuation is 35 million. We have over $8 million in cash in the bank. We have $25 million in tax write-offs. We have revenue. We have cash flow positive revenue. I think we are outrageously undervalued. So yes, I think this is a good time to join the Lexaria family.
Is your long-term plan to grow the company, or would you entertain, an option for being vended into or taken over by somebody else?
The plan is to grow it, and partly because of what I just mentioned. I honestly and vehemently believe we are so outrageously valued that I really think there's an opportunity for outrageous returns just if we can get normal kind of valuation growth. Having said that, I'm also concerned. Although we do have great shareholders, because the valuation is so low, heck, think about what our intellectual property portfolio might be worth. We already have 19 patents granted. India, European Union, America, Australia. We're patent pending in many other areas around the world. That alone might be worth more than our market cap. So I'm concerned that we are so inexpensive that some entity unknown to me might decide they want to take a shot at us and try to acquire us. I certainly don't want to see that happen anywhere near these valuations, but I suppose if the valuations were to grow and if the offer, if it ever came, was rich enough, it's something we would have a fiduciary duty to at least consider. So it's not my preference. My preference and my belief is that we can grow this to become, a $1 billion or multi-billion-dollar valued company. I really absolutely believe that. Our CBD for hypertension alone, I think, could be worth that. So yes, we'd certainly like to have the time to be able to build the value of the company.
Well, you're in a very interesting and exciting position. You've been building this for quite some time, so you've got a track record. As you pointed out, you have money in the bank and no liabilities outstanding. I'm going to be very interested to see how your company continues to grow and the future unfolds for you. I'm hoping that in the future you'll come back and say, told you so.
I hope so too, and I'll assure you, and I'll assure anyone who's watching, this is what we do. I live for this. We do it every day. There is no other priority as high as this in my life. The executive team at Lexaria, some of the most amazing individuals I've ever run across in my career. You can tell I'm not a 20-year-old kid. We have amazing people. We're working with some of the most, highly accredited laboratories in the world. Biosafety Level 3 laboratories in America, the National Research Council of Canada, university research hospitals in Europe and here in Canada. I mean, there are some amazing people that are part of this extended Lexaria team. If anybody has a shot at actually getting it done, I think it's this team.
Well, I wish you great success. Thank you very much for your time today.
Thank you so much.